Hello, and we're back with our patient Michael. This is Dr. GERARD Cuomo. We're now placing the composite putty, and we're just gently putting that right into place. We may end up adding just a little bit more to this after I get that first amount. So notice I'm taking the round portion of the instrument and moving the material down under the soft tissue. We want to keep it down there so we get a good seal. It's going to get a little bit of shrinkage, maybe about 1% if that, or 1.5%, a little bit of shrinkage. But it will shrink to the tooth because it's so shallow. So I'm going to zoom in on that, and let's see if we can see that a little more clearly. How's that, Mike? Pretty clear to you? Yep. Okay. So we do... Let's see if we are in need of adding to this. I think we're in good shape. Yep, we're in good shape. The nice thing about this material, you touch it, it sags a little bit, which is what you want, so you don't get all these little lines. And it's a very nice material. And, I think we got a pretty decent color match there. Yep. So they're ready to go on that. We're going to light cure this again. And these are just 5-second intervals. And we'll do 4 consecutive 5-second intervals. And kind of stop it at 5. Let the tooth hydrate a little bit. Let it cool down. And you got maximum cure here. There you go. Voila, you now have a cover on your tooth. And that has to be polished. So we'll do that next. Are they kind of moving on you? Yeah. Better? Okay. Okay, so I'm going to polish this, and we're going to go beneath your gum line a little bit, but first things first. I'll just start the process. So a lot of movement, low RPM, a lot of movement. You still with us, Michael?
Yeah.
And here we are at the gum line area. So next step is we take, again, I've modified a lot of instruments, and we use a lot of these instruments. There we go. And we just follow the natural contour of the tooth. Very straightforward from here. We go through a sequence of polishers, and it's a pretty nice setup. I have radiuses and contours. I like to contour this. It follows the emergence of the tooth nicely, right off of that little Siltrax cord that we initially placed. And we know we don't want to go past the composite. We want to go just to the dentin, which it looks like we are at this point. And now we'll start to come up a little bit, come up a little bit, come up a little bit. Okay, so keeping the contours. And notice we didn't overfill this. We don't want to have a lot of excess and be here until 12 o'clock tonight trying to polish this thing. So it's important to don't overdo. Just enough. As we say in Italian, giusto giusto. Okay, so I'm going to continue until I follow the actual contours of the enamel. And once I reach that point, I'll stop, and then we'll take out the next polisher. Now this is all really working out nicely. And if they call me in hygiene, I might have to take that little break, and then you can take yours, and we can finish this up. Okay. Yeah, I decided to get more involved with FAU, and going to be going on campus. It'll be September, I believe it's the 16th. I'll be helping out with the FAU Pre-Dental Society mentorship program, and the good people over there are happy to have me, and we're going to be donating a dental chair to the school, and I've got to find a way to get it over there on Friday. So I called up U-Haul, where I do this, where it's stored. It's stored at Boca Storage, and we're going to take the chair, the stool, and all that, Mike, and bring it over. They're really helping me out a lot. The U-Haul people, the storage, they give you a decent truck with a ramp. So the chair weighs about 355 pounds. So it's an authentic chair. It's a good chair. And we're going to do some hands-on. We're going to introduce the students to both clinical side as well as laboratory side. They'll get that hands-on, which you don't find much about dentistry in the science classes. So this will be a big boost to the program. Hopefully we'll keep it going for many years. Okay, so now we can flip the light up, Jen, and we're going to take that little cord out. Now I'm going to reach down there. Hopefully you don't feel any of this. So you still pretty numb? Yeah, you can see that cord's coming out right now, and there it is. Now we're going to reach down and say, oh, we have a little something called flash down there. It's a little excess composite. You got a little bleeding going on. Don't worry about that. So we're going to get rid of that flash down in there. So just a little more trimming, and then we'll polish that. So here we go. Looks like we got a little pocket right there. I'm going to polish. Right, and a little bit more right there. And I stopped when I stopped seeing the white powder in there. It's just that little composite powder. So it looks like we got a tiny little porosity right there. Let's polish that out. It's getting smaller. See. Yeah. There it goes. Nice and smooth. And Jen's painting this blue.
It'll only stay there 3 years.
Yep. She said it'll only stay there for 3 years, Mike. They'll call you the blue bonnet, the blue bonnet patient. All right. Now we're going to come in with another polisher. And this is a little cup. And your gum tissue is going to grow back, you know, to cover that. Right now we suppressed it temporarily by just mechanical means only, but if you, that's a nice little cup, a rubber cup that does a nice job polishing. I'll use another cup, a little more water. A little out of focus. There we go. Good. And then one more. All right. We're back in place. Okay. All right, that should do it. And so we're going to move to the lower. You need a little break at all? You're okay?
Okay,
All right. This is Dr. Jerry Cuomo. I'm going to cut this one short here. We're going to move to the lower, and we'll see you on the next clip. Thank you.